Hi, everyone. Thank you so much for tuning in to today's webinar hosted by the STEEP SRP. Our webinar series is going to has been focusing on PFAS on Cape Cod, connecting communities with science for solutions. I'm Emily Diamond. I'm an associate professor at the University of Rhode Island in the departments of Communication Studies and Marine Affairs. I co-lead the Community Engagement Core for STEEP, and I will be moderating today's session. So thank you all for joining us. STEEP stands for Sources, Transport, Exposure, and Effects of PFAS. It's funded by the National Institute of Environmental Health Sciences, led by the University of Rhode Island, with Harvard and Silent Spring Institute collaborating on the project as well. So the goal for our webinar series is to share findings from the STEEP research with members of the Cape Cod community and a broader audience in order to elevate the voices of community leaders on Cape Cod who are working to address the many challenges of PFAS and to share examples from Cape Cod of how researchers and communities can work together to find solutions. A little bit of housekeeping for today's webinar. We have two wonderful speakers joining us today. They will each give a short presentation, and then we will take questions for both of the speakers at the end. If you do have any questions, go ahead and type those questions into the Q&A box, and we will be taking those in so that we can then pose them to the speakers at the end of the session. As an audience member, you are going to be muted the entire time, and so we can only take your questions by you typing them into the chat. So please use that chat box. So today, I'm really excited for our discussion. We've got two great speakers, great presenters, as I mentioned, Dr. Laurel Schaider from Silent Spring Institute. Laurel and I, together, we lead the Community Engagement Core for the STEEP program. And Cheryl Osimo, Executive Director of the Massachusetts Breast Cancer Coalition and Cape Cod Outreach Coordinator for the Silent Spring Institute. MBCC is a core community partner for our Community Engagement Core and our work with STEEP on Cape Cod. Laurel and Cheryl will be talking about a family of chemicals called PFAS. So if you're here today, you've likely already heard something about these chemicals. If you're new to PFAS or would like a little bit more of a refresher on these chemicals, I'd recommend that you check out our STEEP website for some of our informational resources, and also to find a link to the first two webinars that we did back in March and April that provided more background information about PFAS. So with that, we're going to go ahead and get started. We will start with Dr. Laurel Schaider. So Dr. Laurel Schaider is a senior scientist in environmental chemistry and engineering at Silent Spring Institute in Newton, where she studies exposures to PFAS chemicals from drinking water, diet, and consumer products and related adverse health effects. She works with communities to develop research studies and resources to address their concerns about chemical exposures. In addition to co-leading the STEEP Community Engagement Core, Dr. Schaider leads the Massachusetts PFAS and Your Health study, part of a larger multi-site study funded and coordinated by the CDC and ATSDR in communities across the United States. Before joining Silent Spring Institute, she was a research associate at the Harvard T.H. Chan School of Public Health, and Dr. Schaider earned her master's and PhD in environmental engineering at the University of California, Berkeley, and a bachelor's degree in environmental engineering science from MIT. So with that, Dr. Schaider, I will pass it over to you.
All right, great. Thank you so much. Let me share my screen here. All right. Thank you so much, everyone, for joining today's webinar. And it's really a pleasure to be here with Cheryl Osimo, who I've worked with for 16 years on issues related to water quality and health on the Cape. So for today's presentation, I'm going to be talking about what we know about PFAS in public and private drinking water supplies on Cape Cod, talk a little bit about what's happening with PFAS regulations, and I've tried to put together some resources and responses to common questions that people tend to have I know many of you are calling in from the Cape, but some people are calling in from other states or other parts of Massachusetts. So I've tried to span information that's relevant both locally on the Cape as well as to other areas. For those of you who aren't familiar with Cape Cod has a sand and gravel aquifer that is the source of drinking water for all residents. And on the map on the right, you can see the aquifer has these 6 different sections called lenses. And if you're familiar with topographic maps, when you go hiking, this is a similar map, but it shows the direction of water flow underground. Across the 15 towns on the Cape, there are 18 public water systems. All of them rely on public wells to pull in water to serve their customers. And in Falmouth, there's also a surface water source that supplements some of the public wells there. The vast majority of residents on the Cape have rely on a public water system for their source of drinking water, but 15% of residents do have a private well, particularly on the outer Cape. PFAS have been identified as an issue on the Cape for over 10 years now. The highest levels of PFAS in groundwater have been found in groundwater close to Joint Base Cape Cod, the Barnstable County Fire Training Academy, and the Cape Cod Gateway Airport. These are all places where AFFF firefighting foams have been used for training and emergency response. But other testing has found that lower levels of PFAS are common in parts all throughout Cape Cod. So I wanted to reflect back a little bit on what we've on the timeline and how we've discovered PFAS in drinking water in the Cape. And it was actually Silent Spring Institute who first found PFAS in public and private drinking water wells in 2010 and 2011 as part of a broader study of emerging contaminants. And soon after that work, we learned a lot more about PFAS in drinking water all across the Cape through an EPA-mandated program called UCMR3, which included 4,900 public water systems across the US, including around 15 on the Cape. At that time, the reporting limits were in the tens of parts per trillion for PFAS, so not nearly as sensitive as lots of the tests that we're using now. And the vast majority of samples all across the US and samples on Cape Cod were not detectable. So they might have had PFAS, but at lower levels. What I'm showing here is sort of the tip of the iceberg with the sampling on the right there. And the orange diamonds are samples collected from Cape Cod, mostly from Hyannis. And so you can see that across all 36,000 samples collected across the country, that the Hyannis water samples, and there was one from Mashpee as well, were in the top 1% and sometimes the top 0.1% compared to the rest of the country. The good news is the Hyannis water system has been really proactive and now has carbon treatment on all the wells. But I just wanted to reflect on the fact that we're going to be talking about single-digit PFAS regulations today, but at that time, the highest, most impacted wells were in the tens to hundreds of parts per trillion. So EPA drinking water regulations have changed over time. When we started on this work, EPA had established a guideline of 200 and 400 parts per trillion for PFAS and PFOA. I'm not doing a PFAS 101 today. I guess many of you are likely to be pretty familiar with PFAS, but if you want a refresher or want to fill in some gaps in your knowledge, I will point you to our previous webinar recordings from earlier this year. So PFAS and PFOA are 2 legacy long-chain PFAS that are no longer produced in the US, but still prevalent in the environment. In 2016, EPA lowered its guideline to 70 parts per trillion for the combined amount of those 2 PFAS. Neither of those were enforceable standards. And then they came out with a much lower guideline in 2022, actually, well below 1 part per trillion based on evolving health information showing low effects at lower doses than previously thought. And then last year, they established a standard of 4 parts per trillion for PFAS and PFOA. So 2 orders of magnitude lower than where we started in 2009. They also established standards for 3 additional PFAS at 10 parts per trillion, and then established a hazard index for those 3 and a 4th PFAS together. So the standards are really important action. It takes EPA a long time to put in place standards, but it was based on extensive science. There was an extensive comment period, and lots of important science went into developing these standards. So I think it's a huge disappointment to communities and to researchers to see that EPA is walking back from these standards. Oh, and I wanted to note that according to the original standards, that states had till 2029 to comply. But now these standards are likely to either be rescinded or delayed. So for the 4 PFAS beyond just PFAS and PFOA, it seems likely that those are going to be rescinded entirely. The PFAS and PFOA standards are still going to be set at 4 parts per trillion, as far as I can tell, and that is a strict level, and I'm glad that those at least will be in place. Water systems now will have 2 more years to comply. And I know that it's a challenge, especially for small water systems and water systems in rural areas to meet these standards. And I hope the systems will get support and resources to meet the standards. It's disappointing to see the delay in putting these standards into place, because it means in some communities that exposures will continue on longer. So that's kind of the federal landscape. A lot of state agencies wanted to act earlier than EPA. And so prior to the EPA standards last year, 24 states and 1 territory had adopted regulations, and in some cases enforceable standards for PFAS, shown here on the map. And here in Massachusetts, we were one of those states. The Massachusetts Department of Environmental Protection had put in place a series of guidelines that were increasingly strict for public water systems. And then in 2020, established an MCL, so an enforceable standard for the combined amount of 6 of the most common PFAS chemicals, called PFAS 6. And that level is set at 20 parts per trillion. And at that time, it was among the strictest regulations in the US. So for those of you who live on the Cape now, you might wonder, what's the status of PFAS in drinking water in the Cape now? This is an overview based on a new round of testing, so UCMR 5, that is currently underway. So I did my best to summarize those levels. And later I'll talk about how you can dig a little more deeply if you want to know more about your own water system. So some of the water systems don't have any of those PFAS 6 chemicals in the water, but there are some short chain PFAS. And shorter chain PFAS are the ones that are currently being used in products, and they tend to be more mobile in the environment and harder to remove during filtration. So for instance, in Hyannis, they've put in place carbon on all of their wells, and the long chain PFAS are effectively being filtered out, but some short chain PFAS can get through that type of treatment. There are some systems that have had detections of those long chain PFAS and the PFAS 6, as well as short chain PFAS. And some of these water districts are in the process of putting in place water treatment to filter out PFAS. And then a number of water systems didn't have any PFAS detections, which is really great news. And I think it points to the challenge when people ask me, so what's the drinking water quality on Cape Cod? Because there's not really one answer. There's kind of 18 different answers, because each water district's water quality is dependent on local land use. Private wells, private well owners are often surprised to learn that the Safe Drinking Water Act doesn't actually apply to their drinking water. So in many ways, private well owners are on their own to monitor their own water quality. Sometimes there are regulations when properties change hands or when a new well is installed. But in general, well owners are responsible for monitoring their own water quality. And there's a lot that we don't know about PFAS levels in private wells. STEEP has undertaken 2 rounds of PFAS testing in communities all around the Cape. We asked for volunteers from private well owners living all around the Cape. We conducted an initial round of testing for about 100 wells in 2018, and then 65 additional wells in 2021. The second round of testing included a broader suite of PFAS, so 34 different PFAS compounds, and lower detection limits than we had in the first round. We also looked for nitrate and boron as markers of septic impact, and some trace metals. So overall, we found detectable levels of PFAS in the vast majority of the wells that we tested. We found a mix of the long chain legacy PFAS, as well as the current use or short chain PFAS. And for those of you who are steeped in PFAS work, these are the PFAS compounds we detected most frequently. Again, a mix of the long and short chain. The good news is that nearly all of the wells were meeting the Massachusetts PFAS 6 standard, which is the one that was in place when we conducted this testing. And there was one well that was just right at that 20 parts per trillion level. So in general, we're not seeing a lot of wells with high levels, but of course now we're, with the EPA standards, looking more carefully at lower levels of PFAS. And again, for those of you who are involved with collecting water samples, I just wanted to note that because of COVID, we changed our protocol. Rather than having our team go into people's homes, we provided kits. So we met people in public spaces, walked them through the testing, and they collected their own samples. Throughout the Cape, we saw a slight variation in the detection frequency, and this pattern of having more 100% of wells on the upper Cape and a slightly lower percent on the outer Cape kind of mirrors the extent of land development throughout Cape Cod. We also saw that wells with higher levels of nitrate tended to have higher levels of the PFAS-6 compounds, and this is consistent with our hypothesis that septic systems are an important source of PFAS in these residential areas. And one thing that we're looking at now is longer term trends in both the long chain and the short chain PFAS. And we seem to be seeing trends where the long chain PFAS concentrations seem to be decreasing relative to the concentrations of current use PFAS, which we expect are increasingly going to be entering the groundwater from septic systems. So in addition to drinking water, we get lots of questions about other local sources of exposure. The seminar next month is going to talk about PFAS in fish. But another question we get is about homegrown produce. And in an area like Hyannis, where the drinking water used to have high levels of PFAS, and now it doesn't, people do wonder if there's the potential for any exposures through homegrown produce and yard soils. And so we're just this month launching a new initiative in and around Hyannis to answer those types of questions. So now I wanted to anticipate some of the questions that you all might have. Again, I know some of you are on the Cape and some are off Cape. One question we often get is how folks might be able to find out if their water has PFAS. So for people on a public water supply, you may be able to get that information from a consumer confidence report, which is the required water quality report that all public water supplies have to produce each year. For those of you in Massachusetts, there's a data portal, so you can download a spreadsheet if that's something you like to do. And there's also an interactive map, which is pretty interesting to look at with information about systems that have exceedances of the PFAS-6 standards, and you can read up a little bit about how each of the water supplies is addressing that. More broadly, the UCMR5 data are available online. And again, you can download a spreadsheet, or they have a helpful data finder so you can look up information for your water supply. Not everyone on a public water supply can find information in this way because UCMR5 does not include water systems with fewer than 3,300 customers. If you have a private well, chances are your well probably hasn't been tested for PFAS. If you're trying to evaluate whether it makes sense to get tested, you could check with your town's health department to see if there have been any PFAS detections in private wells in your area. And if you want to find out, and even if, because we know that PFAS levels can vary, even kind of neighbor to neighbor, you might want to consider getting your water tested. In general, we recommend people look for a state certified laboratory. So on the Cape, the Barnstable County Water Quality Lab does now offer PFAS testing to customers. The county actually has a free testing program underway, but according to their website, all the spots have pretty much been filled up, except sounded like maybe some spots still open in the town of Mashpee. If you're looking at across different types of lab tests, you'll note that some tests include a longer suite of chemicals, like more different chemicals to test for. So those tests might be a little bit more expensive. And some labs offer lower detection limits, so a more sensitive test. There are some national testing companies too, some places where you can send away to get a kit to test your water and then you send it back in the mail. And some of those are probably fine, but they may not have certifications. And so if you go with a state certified lab, you might have more confidence in those reports. And then PFAS are on everyone's mind right now, but it's a good reminder that well owners should also follow other testing recommendations. So these recommendations here are from the Barnstable County Health Department, Mass DEP, and different state agencies might have a slightly different recommendations, but you're on your own to monitor your own water quality, and testing for things like coliform bacteria and nitrates should be done annually. And it's important to track those over time and see if there's any changes in your water quality. If you know that there's a PFAS issue in your drinking water supply and you're looking for home treatment, in general, the two types of treatment people turn to are activated carbon, which could be a whole house carbon filter and under the same carbon block, filter pitcher. Sometimes there's a canister pitcher that people have on their counter. In general, carbon does a great job at removing long chain PFAS. Over the lifetime of a filter, not as well for short chain PFAS. Reverse osmosis is effective for both long and short chain PFAS. It can be more expensive, And for every gallon of treated water, it creates a couple of gallons of wastewater. So there can be some issues there. And if you're on a septic system, there's some considerations related to the water flow volume. In terms of knowing what type of filter is good for removing PFAS, the National Sanitation Foundation does provide third-party certification of filters that can meet 20 parts per trillion PFAS. Learning that on their website this morning. I am not sure if that's for the sum of 6 or individually. I can learn more about that. But I will admit that their website is a little difficult to navigate, but it is helpful if you can to verify that the type of filter that you're purchasing is effective for removing PFAS. And so I've provided on the last slide a link to learn more about NSF certification. And then just some other considerations. You should learn about your water first before figuring out what type of filter. It's possible PFAS aren't an issue in your water, but maybe you have a nitrate issue. And in that case, you would look to a different type of filter. So figure out what's in your water first. If there are any issues, because no one type of filter will remove all contaminants. It's always important to maintain your filters as recommended. Boiling your water will not remove things like PFAS and might actually concentrate them more. And then we often get questions about bottled water. Bottled water is helpful in a kind of emergency response, but it's heavy. It's not really eco-friendly or sustainable. I worry about plastic leaching out of bottles into the water. And in general, there's less monitoring of contaminants in bottled water than in a public water supply. Although here in Massachusetts, water bottlers are required to meet federal and state standards, including the PFAS 6 standard. We've got resources on the STEEP website, including tips for well owners and other tips cards like this, as well as a summary of the well water testing that I presented earlier. Our PFAS Reach team has created a website called the PFAS Exchange, including a What's My Exposure tool where you can type in results from water or blood tests, and you'll receive information to help put those results into a context. So how your levels compare to standards and to other water supplies in the US. So just to bring it all together here, ways to protect your water quality. I try to end with some things that all of us can do, especially if you have a private well. You might consider getting that tested and then installing recommended filtration if the PFAS levels are high. And again, test for other types of contaminants as well. In your community, support efforts to protect open land around water supplies because this helps protect water quality. We also recommend avoiding non-essential uses of PFAS in your home when you can. That's helpful for protecting your health, and it also protects water quality. There can be opportunities in your town or school or workplace to change procurement policies to avoid purchasing products with PFAS or other toxic chemicals. And I think one thing that we can all do is when we learn some new information to share what we learned with our friends and family and neighbors. So with that, I'm going to turn this back over to Emily. These slides will be available. So if you want to find any of the links for the things that I've talked about, that will be available. And I appreciate everyone for tuning in today.
Thank you, Laurel. Excellent presentation. We've got lots of good questions coming through. I do just want to remind everyone to please put your questions in the little Q&A box at the bottom instead of in the chat. That's so that all of our panelists can see them and we can ask them at the end. So I'm going to move on to our next speaker, who is Cheryl Osimo. She is the Executive Director of the Massachusetts Breast Cancer Coalition, MBCC, and a co-founder and Cape Cod coordinator of Silent Spring Institute. A breast cancer activist since her own diagnosis in 1991, she has devoted her career to advancing MBCC's mission to prevent environmental causes of breast cancer through education, advocacy, research, and policy change. Through her leadership, Cheryl has expanded MBCC's outreach and prevention efforts, working to ensure that communities, families, and future generations are better protected from environmental exposures linked to breast cancer. So I will pass it over to Cheryl to tell us a little bit about her work.
Thank you so much, Dr. Diamond. I'm honored to be here today alongside the brilliant and remarkable Dr. Laurel Schaider. Yes, we've worked together for 16 years, and I learn something new every time I listen to one of her presentations. Welcome, everyone. I'd like to share my perspective on water quality issues on Cape Cod, why PFAS contamination is a critical concern, and the kinds of questions and concerns we regularly hear from residents. I'll also touch upon some of the key challenges our communities face and explore how scientists can best support and collaborate with the public in addressing these pressing environmental health issues. I will be frank with you. As someone who has lived, worked, and raised a family on Cape Cod for decades, I view our water quality as not only a public health priority, but also an environmental justice issue. Over the years, we've learned that hundreds of man-made chemicals, many of them untested and unregulated, are present in the air we breathe, the water we drink, the food we eat, the products we use every day, and even in our own bodies. As we know, and we are learning, among these are PFAS. Our sole source aquifer is under constant threat from PFAS and other contaminants. Because PFAS do not break down naturally in the environment, they have steadily accumulated in our groundwater, which is our primary source of drinking water. These chemicals come from multiple sources: firefighting foam, airports, military sites, landfills, and even septic systems, amplified by our region's highly permeable soil. Like everyone, Cape residents deserve clean, safe drinking water and protection from harmful exposures linked to immune system suppression, metabolic disorders, pregnancy complications, and cancer. With my role at MBCC and our mission of breast cancer prevention, we are especially concerned about the impact of PFAS on mammary gland development and the potential for increased breast cancer risk later in life. How do we communicate that to a community that reasonably believes that their water is safe because they're paying their bill each month? On Cape Cod, we've been sounding the alarm about pesticides and other contaminants for decades, but PFAS caught many of us off guard. The reality is that managing and mitigating this contamination is not simple. It requires coordinated efforts between scientists, public health officials, and local government agency, alongside community input and advocacy. For example, the Hyannis water system in my town of Barnstable, Massachusetts, has already invested millions of dollars in water treatment to remove PFAS. Barnstable's immediate and proactive response in addressing water quality issues in their community is a model for communities nationwide to consider as we navigate these complex issues. It's a relatively small system, serving only about 14,000 customers, but they managed to do it. This shows that even smaller communities can take strong action, and it's important that other water systems follow their lead with the right support. At the same time, we must acknowledge a deeper reality. Cape Cod is often viewed as a wealthy area, but this thinking often ignores the fact that the Cape contains neighborhoods which can be classified as environmental justice communities, home to many low-income families and immigrants. The burden of paying for clean water disproportionately falls on these residents. When a community must fund water filtration centers to keep their drinking water safe, the money has to come from somewhere. It may mean difficult trade-offs, less funding for schools or public safety. These are the very real decisions communities are being forced to make, and they must be part of the conversation. It's also important to recognize that PFAS contamination is not uniformly spread across Cape Cod. While Hyannis has experienced some of the highest PFAS levels, other areas such as Brewster have public wells that currently show no detectable contamination. This variability highlights the importance of targeted responses and locally informed solutions. In areas that have experienced PFAS contamination, I've heard from countless families who were shocked to learn that so-called forever chemicals were quietly building up in their bodies simply through everyday activities. These stories, grounded in real fear and frustration, reinforce the urgency of our work. Once someone has that realization that they may have unknowingly been exposed to PFAS, the questions start to evolve. The concern deepens. From my work as a resident myself, I know that other Cape residents are deeply worried, and rightfully so. I often hear questions from people across the Cape communities and beyond. And here are some of the questions. Could my cancer be linked to PFAS in my drinking water? My child has autism or ADHD. Did I unknowingly expose them to PFAS while mixing baby formula from tap water? I have high cholesterol and thyroid issues. Could it be something in my water or environment? Will water filters remove PFAS and make my water safer? How much do they cost? What if I can't afford one? These questions reflect lived experiences, fears, and the enormous emotional burden placed on individuals trying to protect themselves and their families. This is where scientists and science itself play a vital role. We can't undo exposures that have already occurred, but we can reduce future exposures, and we can empower communities with scientific research drives not only the discovery of where PFAS contamination exists, but also helps us understand how it moves through the environment, how it impacts human health, and what solutions are possible. Here on Cape Cod, STEEP has become an invaluable partner in that effort. STEEP scientists are working across disciplines to trace how PFAS enters our water, food, and bodies. They're identifying exposure pathways and creating tools to help residents and decision makers understand their risk and reduce harm. The Community Engagement Corps doesn't just share research findings, it listens. From focus groups and school-based outreach to hands-on private well testing and multimedia education campaigns, STEEP is helping to bridge the gap between scientific research and the communities most affected by PFAS. MBCC is proud to be a community partner in STEEP's Community Engagement Corps, working to engage Cape's residents and local officials in efforts to protect water quality and public health. It has been a particular honor to work with the Mashpee Wampanoag tribe. I am especially thankful for Jason Steeding, Tribal Liaison and Director of the Mashpee Wampanoag Natural Resources Department, for his very thoughtful collaboration and commitment to protecting both environmental and community health. Jason, Dr. Diamond will be the featured speakers at next month's STEEP webinar on October 15th. I'm so grateful to STEEP's Dr. Rainer Lohmann for his steadfast leadership and commitment to advancing science that serves and empowers our communities. Thank you, Dr. Lohmann. I encourage everyone joining us today to visit the STEEP website at uri.edu/STEEP, where you'll find a range of resources developed to make the latest research more accessible, raise public awareness, and support community education and engagement around PFAS contamination. PFAS are a priority for the Mass Breast Cancer Coalition. Not only do we work to educate the public about how to reduce exposures to harmful chemicals, but we also actively raise awareness and closely follow key pieces of legislation aimed at addressing PFAS contamination and protecting public health in Massachusetts. If you live in Massachusetts and would like to learn more, send a letter or be directed on how to contact your legislators, visit mbcc.org. While these efforts focus on Massachusetts, we encourage individuals in other states to learn about legislation in their own communities aimed at restricting PFAS and to take action by engaging with local lawmakers. I encourage residents to contact their state representatives to urge support and continued funding for research initiatives like STEEP, which are vital to understanding and addressing PFAS contamination. I wish I could tell you that decades after my breast cancer diagnosis in 1991, we had more answers than we do, that we fully understood how PFAS and other chemicals affect our health, and that we had a clear roadmap to prevent future harm, but I can't. What I do have is more questions. And while that may sound discouraging, I also have more hope because of the researchers, advocates, policymakers, and community members who are working together relentlessly to find those answers. Hope in the students being educated today through programs like STEEP. Hope in the families who speak out, even when it's hard. Hope in the partnerships forming across disciplines and generations. Hope in the leadership of scientists like Dr. Schaider, Dr. Lohman, Dr. Diamond, and in the passion and promise of STEEP trainees and trainee graduates who will carry this work forward. We cannot let ourselves feel helpless. We cannot let the complexity of the issue paralyze us. Instead, we must continue to advocate for stronger protections, more independent research, broader public awareness, and equity in access to clean, safe water. PFAS contamination may be invisible to the eye, but its impacts are painfully real. And so is our power to respond. To every resident who has asked a hard question, who's shown up to a public hearing, written a letter to a legislator, testified in support of stronger water standards, participated in a research study, or simply started a conversation, it's because of you we are moving forward. Thank you.
Thank you so much, Cheryl, and thank you, Laurel, for those wonderful remarks. We have lots and lots of questions from the audience, so I'm going to go ahead and start off with a couple questions for Laurel, and then Cheryl will bring up a couple questions for you, and then we will take some more from the audience. So Laurel, we're getting a couple of questions. This was a really helpful presentation about PFAS in water and how to reduce our potential exposure. But there's some questions about how PFAS in water may relate to or impact other pathways that we can experience PFAS contamination and that might impact human health, such as potentially food consumption. So do residents on the Cape need to worry about food that we grow or air that we breathe or fish or game that we hunt or catch? And is STEEP doing any work to try to understand these broader impacts?
Thanks, Emily. That's a great question, or 3 or 4 great questions there. So in terms of other exposure pathways, that is something that STEEP is aiming to get a better handle on. I think it is important for people to keep in mind that regardless of where you live, that everybody is exposed to PFAS. Testing by the CDC has found PFAS in the blood of nearly everyone in the US based on representative sampling of adults and children. And so we know that we can be exposed to PFAS from drinking water. We can be exposed through food, both locally grown food or food from the grocery store, as well as consumer products. On the Cape, we know there are some surface water bodies that have been impacted by PFAS contamination. The groundwater and the surface water communicate very closely on the Cape. And so there are some ponds where it's not recommended to collect fish on the upper Cape, closer to the base, because of concerns about PFOS accumulation in fish. And we are working with the tribe and with some of the local towns to do some additional testing of fish and shellfish and surface waters to get a better understanding of what those levels are like. It is challenging because the ability to measure these chemicals is kind of outpacing the regulations. So there are fish consumption advisories for one PFAS chemical, specifically PFOS. We don't have a shellfish advisory level, and we don't have advisories for other PFAS compounds. So it can be challenging to communicate those findings. And I know next month you'll be talking about those challenges with respect to tribal perspectives as well. Each community that's impacted by PFAS has slightly different set of questions or concerns. You asked about whether air is an important source of exposure, and that can be an issue in areas where there is a major industrial facility that does have atmospheric discharges that can lead to potentially elevated levels in the outdoor air, but also those emissions can lead to contamination of local soils or local water bodies. I would say that's probably less of an issue with outdoor air on the Cape. There aren't any industrial facilities. Some other research by Dr. Lohman's group and others looks at PFAS exposures inside the home. Some PFAS are volatile and we can breathe those in from consumer products. And so I think it's our STEEP team and other researchers really are thinking about contributions from water, from food, and from consumer products. And I think of a kind of a pie in terms of where people's pie chart of where people's PFAS might come from. And it will look different If you live in an area with water contamination, then those the water might dominate your exposure, at least for those specific compounds. For current use PFAS in products that are used now, it might be that your products are the largest source of exposure for those PFAS. So over time and in different locations, the challenges look kind of different.
Great, thank you. And you know, a lot of our discussions and communication about this can feel kind of down, right? So I'd like to switch it up a little bit, and I'm wondering if you could tell us any hopeful stories about new methods and potential ways to break down or mitigate PFAS in our water and how practical or effective they are.
Yeah, I do think it's important to work in hope to all of this and to talk about what is working. A little more broadly than that question specifically is to think about how much change has happened since 2009 when we first found these PFAS in drinking water. There were no news articles. EPA did have guidelines at that time. They were much higher than what we're thinking about now, but state regulators weren't really paying attention to this. This was not the focus for advocacy. And so in some ways, 16 years is a long time, but in other ways, it's pretty quick to go from really not much regulatory attention to federal standards, state standards. There's been an incredible amount of advocacy. There's been state legislatures who've enacted bans on PFAS in a range of different products. And I think it's ultimately important to turn off the tap at the source and to think about how we can stop using PFAS where we really don't need them to be. And so to me, that's a very hopeful part of this, is that there has been a lot of action and change. And I think an important element to that has been grassroots community groups who've, moms and dads and concerned residents in areas who've really stepped up to ask for water treatment, to ask for blood testing, and making change in their community. These are not people who've been doing environmental advocacy their whole life. They really stepped up because they saw a need in their community. And so that's been a really key element. In terms of any specific methods for breaking down PFAS, I think there's a lot that's happening in that space. I won't claim to know which one or set seem the most promising. But it's encouraging to see that there are new methods that are being developed. And I think in terms of which ones end up being most economically feasible, scaling up to actual water systems will remain to be seen. I think depending on where you are and water chemistry, different solutions make sense in different areas. But I'm glad to see that there's a lot of work on that in that space.
Great, thank you. Well, keeping on that note of not wanting to sow too much additional fear, Cheryl, I'm wondering if you could speak to some of the more effective ways that we could educate our neighbors about PFAS risks without creating some of that unnecessary fear, especially for families who might not have access to all of the scientific information.
Thank you for that question, Emily. That is such an important question because how we share the information is just as critical as the information itself. One of the most effective approaches is to focus on clear, accessible communication that emphasizes practical steps people can take. We've seen that residents respond best when the information is shared in everyday language, not technical jargon. They don't understand it. I often don't understand it. So it's important that we be sensitive to how we relay information to people. For example, explaining that PFAS are man-made chemicals that don't break down and can accumulate in drinking water is a way to connect the science to the people's daily lives. Rather than leading with fear, we try to provide balanced information with what the risks are, what's being done in local communities, and what individuals can do right now, like learning about certified filters. Laurel knows a lot about that. I do not, but maybe you want to expand upon it, Laurel. Staying informed about local water testing, getting involved in local level discussions. And by the way, STEEP again offers a wide variety of resources like findings on PFAS in fish and shellfish on Cape Cod, tips for well owners, tips for infants. I love this one, and tips for families, along with kid-friendly coloring sheets. As a former elementary school teacher, I really appreciate this. Again, you can view and download materials on the STEEP website at uri.edu/STEEP. Thank you.
So Cheryl, just to follow up on that, if attendees here wanted to learn more and get involved, how can Cape community members or schools or other local organizations on the Cape get more involved with NBCC and STEEP's outreach efforts to raise awareness and support stronger protections here?
So there are many ways to get involved, and I'm going to talk more broadly, not just on Cape Cod, but everywhere. People can get involved. And we truly welcome, for the studies we've done here on the Cape, community participation, or anywhere that there's a study going on, people should get involved. I should have been more clear. Residents can help by distributing and sharing educational materials, or even by hosting small neighborhood gatherings. Schools in particular play a vital role. Teachers can incorporate PFAS and environmental health info, science lessons, and STEEP provides resources designed to be age appropriate for younger audience. STEEP has done a fabulous job with their education and outreach. Outstanding. STEEP's Community Engagement Corps also partners with educators and youth programs to build awareness in ways that empower the next generation. Most importantly, STEEP is here as a resource. I should mention that on NBCC's website, you can find information about legislation, advocacy actions, and ways to connect with your representatives in Massachusetts at nbcc.org. On STEEP's site, you'll find toolkits, research summaries, videos that are designed for community use. Together, we can make sure that every Cape Cod resident has the information they need and the opportunity to be part of the solution. Thank you.
Thank you. So we have a number of questions from the audience, getting into some more details about the testing process. So Laurel, hoping maybe you can speak to these a little bit. But first of all, there's a couple questions about variation in PFAS levels across the Cape. So one question is whether or not drought or rainy season changes the groundwater movement or concentrations of PFAS in people's wells, but also the broader question of why do we find PFAS in some wells and not others? If you could speak to that a little bit.
Sure. Well, I'm not a groundwater hydrogeologist, so other folks might have more expertise in that area. But my guess is that if there were to be a long-term drought, that could lead to more concentrated PFAS getting into groundwater, that there would be less dilution from rainwater. So you'd still have the same inputs from septic systems or other sources, but it might be less diluted. And certainly the groundwater flow might be different depending on the extent of precipitation. I don't know how much actual testing there's been to look at changes in levels in Cape groundwater over time, but I think there could be some interactions there. And what was the second part of the question?
Just understanding a little bit better why levels might fluctuate so much even within the same aquifer.
Sure. So we do talk about the sole source aquifer, and everyone on the Cape does rely on groundwater as a source of drinking water. But as I showed on that map, groundwater moves in a certain direction. And so for a drinking water, a private well or a public well, it pulls water from a certain area. And groundwater is also three-dimensional. So sometimes you can have people living in adjacent houses with private wells, and the levels of PFAS in their drinking water can be different because wells can pull from different depths. And so there can be a plume of groundwater containing PFAS, and you might pull water from that plume or above or below that. And so that could lead to different levels. So it can be quite localized, especially for private wells that pull water from a smaller area. A public well pulls from a much larger area, so it kind of averages out over that larger area. But it's not like in other areas where maybe we're pulling in water from a lake or somewhere where the water is well mixed. The levels can be quite variable from place to place.
Great, thank you. We've got a couple questions here about these filters and what happens to them after they have filtered out the PFAS. So I'm going to summarize a few of them here, but do the activated carbon filters, are they considered hazardous waste? And what is the fate of them once they have filtered out their maximum limit of water?
Oh, it's a good question about hazardous waste. I feel like a policy person could answer that question better. And I know some of the regulations have considered exemptions in terms of PFAS in filter material. In terms of what happens to filters, certainly at the municipal level, so just to give you a sense, one of the activated carbon filters contains about 20 tons of carbon. And so I know some water districts, for instance, in Hyannis, the spent filter media goes to a place, a facility in a different state. And at high temperature, the activated carbon is regenerated. So activated carbon is produced at high temperatures. And at those high temperatures, the PFAS are supposed to break down. I think there are concerns about incineration. I think for a while that was maybe seen as a preferred way to address PFAS because high temperatures can break down PFAS. But I think there's concerns about environmental justice and local communities around incinerators and what happens if the temperatures aren't hot enough and the PFAS don't fully break down. So it feels like a little less preferred in some ways, but that is one way. So the carbon filters can be regenerated. But the most of the ways that we currently use to remove PFAS from the drinking water don't break the PFAS down. And so if the material does not go to be incinerated, then it probably goes to a landfill. So it is a big municipal waste issue, and we are concerned about low levels of PFAS in the water, but on a mass level, it's not that much PFAS. So you end up with a lot of material that has PFAS in it. And we don't have a great solution, I would say, at this point. I think some of the promising removal technologies might be able to concentrate the PFAS. So it's quite dilute in the filters themselves. You can get the PFAS off the filter and into a smaller volume. To the point of the earlier question about things that are hopeful, I think there are some technologies that can really break down the PFAS into its component elements that might be hard to do if you're talking about parts per trillion, which is still kind of a dilute level. But if it's more concentrated at parts per billion or parts per million, that would be a strategy that would make more sense. You're on mute, Emily.
Thank you. Sorry about that. We have a couple questions around the links to septic and kind of septics as a source of PFAS. So one question of whether or not you could speak more as to why boron was chosen as a septic impact tracer, and then the relationship between PFAS and nitrates. Do PFAS bind to nitrates, or why are you using that as a marker?
Sure. So it's expensive to test for PFAS and other emerging contaminants, and it's helpful to try to predict where they're likely to show up. And nitrate is something that gets tested for regularly. It's another regulated contaminant in drinking water. It's easier to measure. It's less expensive. And on Cape Cod, the primary source of nitrate into Cape groundwater is from septic systems. And so where you see high nitrate in groundwater, it's a marker for septic system impact. Certainly it can come from other sources. So fertilizers, for instance, can also be a source of nitrate. So it's not a perfect one-to-one relationship. And PFAS can also get into our wastewater. We have products in our homes with stain resistant or waterproof coatings or fibers from our upholstery, food packaging, even potentially rinsing cookware. We don't really have a good handle exactly where PFAS come from in wastewater, but we know wastewater has PFAS. That's not surprising because the wastewater coming from our homes reflects the chemicals and the products in our home. So it's really that the nitrate, where the nitrate tends to be high, that's an indication that there's septic system effluent getting into the ground. And so we think that there could be PFAS getting into the ground in the same place. It's a good question, why boron? So I mentioned that nitrate can come from other sources. So you might see high nitrate, but it could be from a golf course, and it might not necessarily mean that there's septic impact. Boron is used in borax and some other types of detergents. And so it can also be a marker of septic system impact. It gets a little tricky right along the coast because it's high in seawater as well. So if there's any saltwater intrusion, it's a less good marker. But for us, it's helpful where we see both nitrate and boron being elevated. That gives us a little more confidence it might be an area impacted by septic systems. So that's why we looked at both of those tracers.
Excellent. Thank you so much. And thank you all for the so many questions. We unfortunately, we don't have the time to get to all of them. There were several questions about kind of the process of getting your wells tested, whether they need to be tested, how to go about and do that. I know Dr. Schaider did talk about that a little bit in her slides. So I do just want to reiterate that this webinar has been recorded and it will be available on our website. So you can go back to our website and take a look at it at any time. You can also learn more there about STEEP's work on the Cape and especially around drinking water and private well testing. I do just want to take a moment to let you all know about our next webinar. So on October 15th at noon, we will be continuing our discussion here with myself as well as our STEEP tribal liaison, Jason Steiding, who's the Natural Resources Director with the Mashpee Wampanoag Tribe. We're going to be talking about some of the work that we have been doing in partnership with STEEP and the tribe on the Cape, specifically about risk communication, cultural importance of fishing and shellfish, and potential impacts from PFAS within the tribal community, but also more broadly on the Cape. So we do hope you can join us there. You can scan that QR code to register, and we will be seeing you again in about a month. Thank you all very much for attending and for your questions.
Thanks for moderating, Emily, and thanks everyone for tuning in.
Thank you so much. Have a great rest of the day.